now? Okay, so we're going to have a recording of this for those who couldn't make it, and it will be on social media available for people. And if you're okay being on camera, feel free. If you're not okay, that's okay. So if you are planning to ask any questions but don't want to be on camera, you can always send private message to Olga or me, and we're going to talk about this. Okay. So I decided today to talk about thyroid a little bit, to explain how thyroid works, because it looks like a lot of us not aware how important thyroid is for all of us. And I was just going to emphasize the importance of not just the thyroid function, but those supplements that we take, how important they are as well. So thyroid is a conductor of endocrine organs. All the endocrine organs that you have in your body, they are being conducted. It's an orchestra. And the thyroid is the conductor, is the director. So it depends how director is acting. If director knows what they're doing, if director is very professional, the music comes out beautiful. If director is not balanced, if director had a bad day, that day symphony probably not going to be as beautiful. And that symphony is your balance of your not only hormones, but entire body, your skin, your hair, your mood, your energy level, your bowel. Basically, everything depends on your thyroid function. Imagine. So when your thyroid is being nurtured, when you're giving all the nutrition that she wants, then your thyroid pays back with a beautiful metabolism, beautiful weight, lots of energy, productivity, no brain fog. That is the balanced thyroid. When we don't have that, when we don't have good nutritional environment for your thyroid, when we don't have good rest for your thyroid, we're constantly keeping thyroid in inflammatory state. This is when she gives up and gives us problems. So there are two types of thyroid diseases. One is hypothyroidism, which is low levels of thyroid hormones, and that's why underreactive thyroid. And when you have that, it's usually everything slows down. Your speech slows down, your movements of your body slow down, your comprehension, everything just goes just slower and slower and slower, including your bowel, and you name it. Your reactions that you have in your body, everything starts slowing down. And then there's another one called hyperthyroidism, when everything speeds up. Your metabolism, the muscle growth, and not growth, but the muscle movements and everything just goes up, including your bowel movements and so forth. And you would say, oh, that's good. No, when it's too much, it's not good either. This is when your heart can suffer, your kidneys can suffer, you start wasting muscle. So this is not good either for us. Everything is good in balance. Life is all about balance. And what is the most important factor for thyroid is vitamin D. Yes, guys, vitamin D. That's why I'm so big on vitamin D, because it plays a major role in every function of your body. And today we're talking about vitamin D and thyroid. So I always give this analogy. If you are thyroid, you're a manager of the office, and you have this assistant, and her name is vitamin D. An assistant is not very productive. She doesn't have a very good work ethics, calls out sick all the time. And you, as a good manager, you doing triple work, quadruple work in the office, so office would look good. So when you have people in your office and they come and say everything looks perfect and you look so good, and you smiling, deep inside you are exhausted, you're tired, you're not happy. This is how thyroid feels when the vitamin D is low. So when people do their blood test and they say, I felt exhausted, I still feel exhausted, I have no energy, my doctor did my thyroid check, thyroid was normal. What about vitamin D? Oh yeah, they mentioned that vitamin D was low. And you see, so this is how it all starts. You fix your vitamin D first. And this is when your thyroid all of a sudden starts getting steam. And all of a sudden your metabolism and all the reactions are going off the charts all of a sudden. And people say, oh, I'm doing great. So that's one variation on the blood test. And I'm giving you this possible scenario because when you're going to go and see your primary care doctors or when they check it, even if your thyroid is looking normal, but your vitamin D is not, then you know this thyroid, she's not happy. She's not happy. She needs some help. Now, with other elements that also very important for thyroid are fats. If you eat only vegetarian, vegan, you want to make sure that you're loading yourself in good fats. If you eat everything, if you're omnivore, just make sure that you're loading yourself on some kind of animal fats. But fats are very, very important to support your thyroid. Just like last time when we spoke about your steroidal hormones of the cortisol, this time we're talking about hormones of your thyroid. Fat is one of the most important factors to heal your thyroid, to heal your endocrine system in general. So today we talk about thyroid. Another one is iodine. Deficiency in iodine is very common, unfortunately. And some people take iodine supplements. Some people take iodine-enriched foods like seaweed and shrimp. And honestly, I think it's okay. Whatever you take, it's fine as long as you're not loading yourself with the mercury, especially if you're eating shrimp. Just don't forget, shrimp, although it's just seafood, it actually sits on the walls or on the body of the big fish. And with the big fish, can actually go deep in the ocean and get some mercury and some other heavy metals. You have to watch out for those. But iodine is another very important supplementation. Again, not necessarily taking as a supplement as a capsule, but in the form of using your like seaweed, for example, or shrimps, or some other source of iodine. Some people take Lugol solution, which is a solution that we use in the medicine, a very strong 5% iodine solution, and they do a couple of drops in the water and take that. Iodized salt that also has iodine. So just make sure that you are supplementing yourself. So fats, vitamin D, iodine, protein. Protein is another one. You need to make sure that you're getting enough good protein. And that's why I'm such a big believer now. Not only believer, but I love the carnivore diet because it's actually easier when you carnivore. You get your vitamins, you get your fats, you get your micronutrients and the protein all at the same time, and you're supporting your steroidal functions of your adrenals, of your thyroid, of your ovaries, and so forth. So then there's another condition, autoimmune condition, when your body starts to attack, starts to recognize your thyroid as a foreign body and starts to attack it. Okay, attacks it in the form of antibodies. That's why my panel consists not only to check your TSH, T3, T4, which is TSH is one of the parameters of the function of the thyroid, TSH, thyroid stimulating hormone. And there is another hormone that your thyroid produces, T4 and T3. So those hormones are that play major role in the function of your thyroid. but then we also check for antibodies against the thyroid. And when you have certain antibodies, which is above certain level, for some doctors 500, for some doctors 1,000, by definition is 1,000, we call it Hashimoto thyroiditis, which is inflammation of your thyroid tissue due to attack by your own cells, recognizing your own thyroid as a foreigner. And this is, by definition, we call it autoimmune disease. Okay. So we're going back to vitamin D. There's a correlation between the level of your vitamin D and the level of antibodies. The higher the level of antibodies, the lower the vitamin D, and vice versa. And the higher the level of D, the lower the level of antibodies. And I have patients who bring their level to 80 to 100, but the antibody is still there. And they go, how come? Why it's not going away? I'll tell you why. You have to stay at that level of high level of vitamin D at least for a year. How do I know that? It's my own experience. Back in the days, a long time ago, in my 30s, I developed thyroiditis. I actually developed thyroiditis in my 20s, and it wasn't recognized. And I gained a lot of weight, and I felt like crap. And then when I was already practicing in my late 30s, this is when I developed it again with antibodies against my thyroid. And this is when I realized that it needs at least to be a year. It took me a year to see some movements in my antibody levels. And then slowly, by staying on it for now, more than 20 years now, no, about 20 years, now I see zero antibodies and my thyroid is functioning properly. Okay. So I think I covered. So yeah, and then also the treatment, right? You asked me if my thyroid is working, if it's abnormal, my doctor wants to put me on Synthroid. So my first thing, and you know me, I believe in human body. I believe that human body knows how to fix and heal itself. So my theory and my approach is to provide all the necessary things for the human body first, for the thyroid to heal, like we just went through vitamin D and all these other changes in your diet. And then in that case, if you're still showing signs of abnormal thyroid function, even if your vitamin D is 80 to 100 for a long period of time, saying that 6 to 8 months at least, then I would go with Synthroid. But most of the time you don't need it. Most of the time you don't need it. And that's how I approach the treatment. Okay. So that's probably all about thyroid. But if you guys have any questions, you can ask me now. It doesn't have to be thyroid related. I just wanted to bring us a little information about, each time I bring some information about different things. And like I said, it's going to be on social media. If you missed the beginning of the meeting, you can always go on YouTube and watch it again. But yeah. So any questions, guys? Ask me anything. I'm here for you.
Okay, can I?
Absolutely, yes. Bye.
Okay, thank you. My name Maria. I need prescription for my oral contraceptive, and when I know if I use this contraceptive before I moved to New York.
Okay.
And I have previously prescription for different doctor, different clinic, but with prescription it's not
valid, active. It's not active.
Now this prescription is not active. I need new prescription for my insurance because my insurance cover my prescription, and I can both it's same medicine, but I know with the US it's a different system because in my country, in my native country, we don't need prescription for this. But here it's really important.
Yes.
If you have prescription, you can buy this.
Are you in our system? You saw me in New York?
Yes, now I live in New York.
No, but did you see me in New York?
Yes, I see you in New York. Yes.
In New York, yeah, because I have two locations, New York and Florida. So
Uh-huh.
for that type of questions, we have email cpmp at Central Park OBGYN.
Just
Yeah,
a moment.
Olga would put, Olga, can you please put our email and just email to girls and they will contact with you and we will take care of it. Yes.
I put my my mail on the chat.
No, you're gonna have to email us. Olga will give you
Ah,
email and she will and then you will send the email stating that
mhm.
you need prescription and girls will take care of it. Yes.
Okay. Thank you
Yeah.
so much.
Yeah.
Thank you.
Yeah, I'll drop in the chat shortly. There's a question: does hypothyroid or fibroids cause high level of inflammation?
Absolutely. And now this is like a chicken or the egg. Which one comes first? Is the inflammation comes first, or the thyroid, or the fibroid? Which one of them? Now, once we have all of that, it's hard to say who came first, but they all come from one thing: inflammation. And the name for another name for inflammation is inflammaging, because when the person stays, or the body stays in inflammatory, chronic inflammatory state for many, many years, this is when the weakest part of the body starts to show up in the form of pathology. So let's just talk about first, you said fibroids, hypothyroidism, then you said fibroids, and what else? And inflammation. That's it, right? Those two conditions?
Yes.
Okay. So thyroidism, hypothyroidism, it usually starts as a thyroiditis, which is inflammation first. And then it starts to show antibodies if it has autoimmune component to it. Again, thyroid doesn't just wake up one day and becomes abnormal. It's a chronic deficiencies in vitamin D that causes inflammation in the thyroid first. That causes systemic inflammation, contributes, not causes, but contributes to systemic inflammation. That causes weight gain. And then in the weight, like in a certain, not supposed to be like overweight, but then there's certain pockets, fat, that collects certain hormones. For example, estradiol, our estrogen, loves sitting in the fat. And guess what estrogen does? Estrogen helps fibroids to grow. It's like a fertilizer. See how they all connected with each other? So yeah, it's absolutely connected. And the way you start your healing is you focus on inflammation, detoxification, inflammation. For those who are interested, we have beautiful programs. You can visit our website. We have different programs to detox on the, like if you want to do IVs, or if you want to do E system with us, if you want to do, we have also program, like a very, very comprehensive program, 3 months program of detox, cellular detox on the cellular level. If you're interested in that, we have all these options if you would like to have. And one day we're going to talk about detox as well, like in details, how to do it. One thing I'd say, if you want to do detox yourself today, please finish your detox by probably, I'd say mid or beginning of December. Why? Because detoxification is the stressful, it's a stress on your body. So if you're doing it during the winter season, it'll be too much on your body. So be careful. Make sure that you are doing in the specific seasons. And if you want to do, absolutely need to go during winter time, make sure that you are going under supervision and make sure that you are gentle on yourself. Okay. You're welcome, Yunan. Thank you.
There is another question in the chat. Question about thyroid issue runs in the family. A person who's asking, is there ways I could be avoiding this happening to me as I age? That's question number one. And then two, what are the best vitamins I should be committed for overall health, to overall health?
So, you know what I'm going to say? I'm going to say vitamin D. Of course, there's so many other vitamins that are so important, but if you want to really boil it down to the most concentrated and easy answer, I'd say vitamin D. And this is my theory. Chronic deficiency in the family of vitamin D causes not only thyroid issues, but any other endocrine issues. And I see it all the time. I have couples who come for treatments, either infertility or some other problems. And when I do blood tests on them, their blood mirror each other. Why? Because they live the same lifestyle. They live in the same household. Even numbers of vitamins are the same. It's amazing how they mirror each other. Whether, you know, it's husband and wife or daughter and mother, it doesn't matter. So I'd say it runs in the family. It's probably because the weakest part in your body, according to your genes, it's probably thyroid, one of the thyroid diseases, but it doesn't have to happen. And if you're going to keep your vitamin D levels, guys, optimal, not just normal. Let's go about, again, vitamin D levels. The norm is between 30 and 100 in the blood test. I'm talking about not the dosage, but the blood level. Keep your levels and optimal levels at 80 to 100. Don't settle for 50 or even 60. It's not enough for us. 80 to 100, that's the number, okay? And if you're going to keep that, that would be great. Now, when you take and keep such a high level of your vitamin D in the system, again, we spoke about this last time, but I'm going to repeat it again because it's important. It is important to also take other fat-soluble vitamins like vitamin K2, okay? Otherwise, your body will be suffering and you may end up with some calcification in the places where you're not supposed to have them. So vitamin K2 usually comes 100, sometimes 150 milligrams per tablet. And the way I take it, because I found out in one of the studies that this is how they work the best. If you take 50,000, one tablet of 50,000 units of vitamin D, plus the whole weekly dose of vitamin K2. So what I take one pill of 50,000 of vitamin D, and then I take 7 pills of vitamin K2 all at once on Monday. That's my regimen. And I've been doing this for many years. So I don't have any calcifications and I'm okay. But this is something to consider. Is any other vitamins are important? There's tons of vitamins, so many. And I don't want you, one thing I don't want you to do, I don't want you to go crazy about taking capsules. You all live life. We all came here to enjoy life. Life is too short. So you need to be aware what needs to be taken, and you need to make it as quick as possible, as easy as possible, and most effective as possible. So me being a New Yorker, living life between double life, I call it, between Florida and New York, running around 2 practices, I need to take care of myself, working 7 days a week, 24 hours a day. So what I do, I take, like I said, Monday is vitamin D and K2. And on a daily basis, I came up with the powders. To me, powders, I think, are easier to digest. There's no fillers in the powders. You know what you're taking. Make sure that you do your research when you buy those powders. My favorite is Organifi. Why? Because I tried it so many other powders, and I found that Organifi is something that doesn't cause any problems, doesn't cause any side effects. And the best part is the skin. Everybody compliments me. I'm 53 years old. Everybody says that I have great skin. Why do you think that is? I think it's my vitamins. I think it's my Organifi. It really gives you that glow. You see? So of course, I get my IVs, but I think even before I started doing IVs regularly, Organifi really changes the texture of your skin and brings oxygen. So that's my favorite, easy, 1 scoop and good to go. There's also, I'm a big believer in adaptogens, and we spoke about tinctures last time. I have these, well, my girls are keeping here at the front desk. So there's another formula that I don't have it now on me, but one of them is, we call it Divine Masculine. That's how it looks. And then the other one is Wise Mushrooms. So, and then we have Divine Feminine. So Wise Mushrooms are nervous system optimization. The content of these mushrooms tincture is cordyceps, lion's mane, turkey tail, all these adaptogenic mushrooms, including also B complex vitamin. And they are, what they do, they basically optimize your nervous system, and you become more resilient to the bullshit that's around you. You're not going to be as reactive. And why it's important? Because every time when you're reactive, you produce cortisol. You produce cortisol. You produce inflammation. You produce inflammation. You're screwing up your endocrine system like thyroid. And the thyroid, it's just a trickles down like a chain reaction. So that is something to work. It's good for those who have, let's say, students, for example, those who have exams and very like mental work, lots of mental work. This would be really good. This is really good for those who are having problems with memory, brain fog. This is good. Focus. This is good. So my favorite, the one I take, and this is Divine Masculine. Most of my male patients take it and they love it because what it does, it makes you produce your own testosterone. This is not testosterone supplementation. It stimulates your body, so your body would produce your own testosterone. Okay. And I love it. It looks like my body needs testosterone. I need some balls. So I'm using this. What it does, it makes you focused. It makes you motivated, keeps you happy. So I love it. I have patients, female patients taking it. My male patients loving it. It increases sexual performance as well. So it's pretty good stuff. And then we have, it's not here, but same type of, similar type of formula, a little different, that stimulates your estrogen. And we call it Divine Feminine, okay? And that I take when I become too, like if I feel that I'm becoming like more masculine, I have this breathing mechanism inside of me, my emotions and all that. If I feel that I need to, calm down a little bit and become more gentle and feminine and gentle, which a lot of times very rough on the edges. This is one I start taking my Divine Feminine. So I don't take them all at once. I usually rotate them, but this is something that I'm just giving you my routine. This is what I do. This is what I do. That's it. This keeps me sane. Vitamin D keeps me less inflammatory. And Organifi helps me to boost my immune system and so forth. And of course, at least once a week, sometimes every other week because I'm so busy, I spend some time in E-system room and I get my IV therapy, which helps a lot. And those who come to my office, you guys know how much, benefits people get from IV therapies. And we're getting such a great results. By the way, today we had 2 people. One of them was just drastic results. Male patient lost lots of weight, had problems, but this is he comes all the way from South Carolina. So if he's watching me, hello, shout out to you. So he got amazing results. He looks amazing. He lost a lot of weight. And he says that he sleeps only 4 hours a day and he has so much energy. He was almost like maniac today, like in my office, running around happy. So yeah, like if you do it, and of course, it's not just taking vitamins and supplementation. It's also cortisol decreasing activities that we discussed before that, if you remember: breath work, acupuncture, yoga, meditation, spending time in the E-system room. Like this guy, he comes all the way from South Carolina to spend some hours in the E-system room and get the IV in. Amazing. We had one patient yesterday who had major oral surgery with the implants, extraction, implants, it's all together. She came in yesterday. She got her IV yesterday. Today, swelling is gone completely. No swelling. Recovery like 24 hours. Done. Not even 24 hours, less than 24 hours. So there's many ways to stay healthy. There are ways that, some, if you can afford, good for you. We have it for you. If you can't afford, we can come up with something easy and affordable. But it must not be excused to say, oh, I don't have time, I don't have money, I don't have this. I will prove you that it's possible to stay healthy. You don't need that much time. You don't need gym membership if you don't have money or time to go to gym. All you need is just 10 minutes, 5 minutes of your time, 15 minutes of your time every day. But do it every day, and you're going to get cumulative effect and great outcome. And it's all on my YouTube channel. I'm going to add on more exercises. Just do it, and it's going to be great. I had a skiing injury last winter, ACL. I have PT through the injury, and I do yoga daily. I've had knee, but I have chosen not to do surgery. This sounds like something I should try. This is one-time thing or a consistent thing for the results. Kara, are you asking about IV therapy and E-system?
The one that you just said about the reducing of swelling and that somebody came in the room.
Yes.
Is that one time, or you have to keep coming?
Well, that particular person came post-op. So we have this dental oral surgeon that sends her patients to me for that particular thing. But if someone has chronic inflammation, one thing when you have acute inflammation, so your recovery, instead of being 5 days, shortens down to 20 hours. Big deal. But if you have chronic inflammation, then you're probably going to need something more, like maybe once a week type of thing, and then maybe add on some other things. And it's on individual level. We're going to have to talk about this. So if you have any questions, we could talk. There are some exosomes. I want you to read about exosomes, which is, it's not a stem cells, but I am actually started clinical trial. I'm doing observational clinical trial in my practices for stem cell technology. So if someone wants to, explore that, let us know.
Yeah, I did actually hear about that as an alternate option to the
Yes.
surgery. I did.
I'm getting great results with that. It's just amazing. Not here, but in Florida, we had one guy 2 weeks ago. He had accident 10 years ago and injured his neck. So it's getting worse and worse. And he called one of my patients and said, do something. So she called me, and I saw him that day. So for that, we use different modalities called acoustic wave therapy. And I gave him a blockade with the lidocaine, and I gave them injection of the stem cells. The pain that he had in the past 3 weeks, that was nonstop. He couldn't sleep. Grown-up man was crying. Grown-up man was crying in pain. After the procedure, he walked away pain-free.
Wow. From one procedure. And is it like a cortisone shot where you have to come back? And
Absolutely, it's not a cortisol shot.
because that's what they offer me, and it's like, oh, I'd rather do yoga. I'd rather, just
Cortisol shot is good. Dexamethasone, not even cortisol, I use for postoperative swelling. Excellent. It helps. Only dexamethasone, only once. Cortisol shots for injuries, it's usually a temporary thing. It brings the inflammation down, but it doesn't go to the root of the problem. Okay? But when you follow those naturopathic protocols, again, guys, this is not medical advice. This is all educational. I'm showing you what is out there is being in the research, and actually I am part of this clinical research trial right now. So this is something, I think it's a medicine of the future, and the more of the doctors will do this clinical trial and involve more patients in this, the faster it probably will be approved by authorities. Because
and is this on the YouTube channel as well? If I'm gonna have them post your YouTube channel, but is there stuff that I could look on about this?
you could look, for example, if you're interested in exosomes,
Okay.
you can look up exosomes. You could look up in stem cells. But one thing I'll tell you about stem cells and exosomes, the reason why it is not approved by FDA, because it could be dangerous.
Right.
Because it is all depends on what is it coming from. It could be toxic, it could be dangerous, people die from it, people lose, lose their organs and so forth. So the source is very important. So since I am a part of this trial, I am part of this observational study, we are using, it's a group of doctors that we are using specific FDA registered, because they're not approved, FDA registered labs that are located in the United States. And as a doctor, as a provider, each of us, as a responsible provider, we have to meet with the manufacturer themselves, directly talk to the scientist who's working, and check everything that is coming, like all the sources and donors. So when you get your stem cell from this trial, you actually know there's a number, there's no name, but there's a number of the donor that gave it to you, so you can be able to track it down. And there's a very strict criteria. Woman has to be watched all her pregnancy, she has to be healthy, the baby has to be healthy, the way it was, it's like a very strict criteria. And it's all registered by FDA, and the FDA is checking them every quarter. Okay. Only so if you decide to go with something like this, you have to make sure that it's very reputable source, and make sure that it's done by people who are in the research and registered. Very important. Yeah. Could you please list the brand names and supplements that you take? Those supplements are actually on my website. Looking forward to her. Thank you. These supplements, so this is my brand. This is my creation. Okay. So whatever you guys see, I did it. It's my creation. It's on my website, and it's in my office. The other one is not my creation, but I know people who made it. I know the owner of Biotech. He's 90-something year old, 96, 94. The guy looks like he's like 60. That's how great he looks. So clearly his vitamins are working. And I've been taking his supplements since, I don't know, 2004, 2005. It's called Biotech. So you can go on our website and you can check. Our office has it too, so you can come in and pick it up if you want to. By the way, it's very cheap. It's not expensive at all. $35 for the bottle. And that bottle, since you're taking only once a month, once a week, will last you at least 24 months, at least. So if you really calculate how much you pay for your 2,000 units, 5,000 units, 10,000 units of best vitamin, you're probably spending around 200-ish a year, 400 in 2 years. And here you're getting best quality for such a small amount of money. Like I said, I'm trying to make it as affordable, as effective, as doable as possible for you guys. And the juice, the green juice, Organifi green juice, you can buy it on Amazon. We do have it on our website. We do have very good discounts on our website because Olga did a good job by bringing the price down. So we have one of the lowest prices, I think, everywhere on the web. So look it up. And Organifi has different type of variation: green juice, pink juice, yellow juice. Each of them have different functions. So check it out. Alrighty, so it looks like we had a good conversation. I'm loving it. Thank you so much. Let me know, guys, if Tuesdays are okay with you, because I thought oxalates. Okay, I'm gonna talk about oxalate. I would talk about anything you want, but if you feel that you are the Tuesday is not a good day for you, also you can drop the vote and you can tell me. So I'm still in the exploration mode to see which days are best. We try to do it on the weekends. We try to do on the Tuesdays. So far, I'm just going to stick with Tuesday. Okay. Oxalates. Oxalates happens usually if you're, again, if you have metabolism working not the way it's supposed to work. Okay. Dysfunctional metabolism of certain salts, enzymes can create oxalates, sediment, and then they turn into stones, kidney stones, and some of them actually can be stones everywhere. Under your skin, it could be anywhere. So, to be honest, if someone can eat spinach and do other things and eat tomatoes and they don't have any consequences in the form of stone formation and the problem with the urinary tract, go for it. Everybody's different. So I believe that we all have enzymes to digest certain type of food. We have different types of bodies. And one day I'm going to talk about different types of bodies, different elements, and one food that healthy for me may not be healthy for you, and how to discover and how to determine. We're going to talk, it's a long conversation, but we're going to do that. But speaking of oxalates, again, if you're someone who is producing oxalates, you're going to have to stay away from it. Number one, and number two, you want to make sure that you are alkalinizing your body as much as possible. Keep it as alkaline as possible. Yeah. Okay. Alrighty. That was amazing. Thank you, everybody. I'll see you next week. And Maria, please email. We will try to help you with your birth control. But you guys, yes, you guys just tell us. You can always email and ask questions if you're interested in anything. But you just gave me a good idea to maybe next time we're going to talk about body types. We're going to talk about Ayurveda. We're going to talk about the queen of natural medicine. It's not even medicine, it's philosophy, but we're going to talk about that beautiful philosophy. Very good. Thank you for coming. I love you all, and I'll see you in a week. And thank you, Olga, for supporting.
Thank you so much.
Thank you. Bye.
Bye, everyone.